Good morning. I would like to introduce my guest, Dr. Thomas Hofmarcher from the Swedish Institute for Health Economics.
Hello, pleasure to be here. Thank you.
The Swedish Institute for Health Economics has recently published a report of women's cancers in Poland. Why is this subject so important?
Well, so we published this dashboard on women's cancers in Poland because there are many important reasons to look specifically at this topic. One is, of course, cancer is a priority. Cancer is the second leading cause of death in Poland. And the reason why we look specifically at women with cancer is because we have seen quite a unique situation in Poland compared to the rest of the EU countries where in the past there were always more men than women that got cancer. But this has changed in the recent years, so nowadays more women than men get cancer, and the predictions by the Polish National Cancer Registry show that the gap will even grow larger, and by the year 2026 there might be 100,000 women being diagnosed with cancer during that year and only 90,000 men. So this is one reason why we wanted to look at women, and then we look specifically at women's cancers, so at breast cancer and different gynecological cancers like cancers of the uterus, the cervix, and the ovaries.
Okay, why, in your opinion, the data is worse than for other European countries?
Yeah, so I mean, what we tried to do in the dashboard is really look at the extent how good or bad is Poland performing against, let's say, the EU average, or neighboring countries like the Visegrad countries like Czechia, Slovakia, Hungary, and also the aims that were specified in the national oncology strategy in Poland, because there is a national oncology strategy with aims, but the question is, what is the current status? How far are we away from these aims that are defined? And this is something that we looked at. And then when we looked at the results, we saw that the most important overarching indicator is survival. I mean, if a woman gets cancer, then of course her biggest concern is not to die. So survival is important to look at. We see survival. Unfortunately, Poland is below the EU average and also below most of the Visegrad countries, so lower than Czechia, for instance. And that's concerning. And then that motivated us to ask the question, why? Why exactly? So and there are different reasons, and we looked at different indicators. One was the money, the investments that we make in cancer care, and there we see that Poland is spending 94 euros per capita on cancer care. The EU average is at 195 euros per capita, and 94, 195, that's all. It's more than it's like half of what the EU average is. And of course that could be one reason, but money is not everything. I'm a health economist. I also want to know how the money is used, because you can also make good things with little money. So we also looked at, the whole organization of cancer care, different areas. We looked at prevention, we looked at early detection, we looked at diagnosis and treatment and survivorship to really see what is the money being spent on, how are we comparing in these areas. And if we look at these different areas, you see that mostly Poland is in the red area. So we are below the EU average and also a bit lower than neighboring countries, and for most indicators also we're missing the aims defined in the national oncology strategy, and that's concerning. And just to give a few examples in the area of prevention, for instance, what's really important for women's cancers is we can prevent one entire cancer type, which is cervical cancer. We just need to make sure everyone gets vaccinated against the HPV.
Yeah, that's my next question is, what are the main recommendations for change for Polish decision makers, scientific leaders to improve efficiency of prevention programs and patients' outcomes?
Yeah, exactly. So I think that's an excellent question. And the answer is really, with prevention, I mean, there are different risk factors, but the most important one when we talk about women's cancers is HPV vaccination. And since June last year, 2023, now finally the NFZ in Poland is reimbursing the HPV vaccination for girls and boys. But if you look at the vaccination rate so far, there are around 17% of girls and boys that are vaccinated. If you compare it to Hungary, you have 80%. 80. So, and that also means that Poland is far away from the national oncology strategy aim. There you have an aim of 60%. Europe's speeding cancer plan has an aim of 90%. So there's still so much more to be done for HPV vaccinations. And then it's also in other areas because, you know, many women have not been vaccinated now, so they might get cervical cancer, and then it's important to detect it as early as possible. There is a screening program in Poland for cervical cancer. There's also a screening program for breast cancer, and they are quite similar in terms of participation. Not all women that should go to screening, which means many cases are detected late, which is more difficult to achieve high survival rates. And this is another area, you know, where it would be important to achieve improvements. And the third area is really in diagnosis and treatment, where we see lots of shortages of specialized physicians, because you need a pathologist, you need a radiologist, you need a medical oncologist, you need breast cancer surgeon to treat women with women's cancers. And across the board we see shortages. So women have to wait. The organization of the care is not ideal. There's also the lack of equipment to make the diagnostic procedures necessary to inform what kind of treatment should you receive. And then when you come to treatment, finally, then the access to medicines is not so good. And we have seen for most of these women's cancers great progress in the last 20 years, actually. Many new innovative medicines and drug classes have been developed. But then the sad reality is that women in Poland don't have the same level of access that you see in neighboring countries like Czechia or the EU average, and they have to usually on average wait 2 to 3 years from the time when the European Medicines Agency approves a new medicine until it's reimbursed. And then you might have to wait actually a few more years until you can access it at all hospitals in Poland, because in the beginning it's often only the university hospitals or the comprehensive centers that have access to the newest medicines, but not other smaller hospitals.
I think the big problem is prevention in Poland.
Yeah, no, I think I agree. There is lots to be done. I think it's important to be comprehensive, to look at all areas, and also to consider the economic aspects, because, you know, prevention, it's the cheapest method, because every case that you prevent means you don't have to spend money on treating the cancer. And early detection is also the same thing. If you detect breast cancer early, you have a very high chance to survive, but it's also much cheaper to treat a breast cancer early than when you discover it late. So it's another way to actually save money, save resources for the healthcare system. And for cancer medicines, it's also similar. There are many cancer medicines. Not all are equally good. By prioritizing the innovative ones, where women can really benefit and achieve great improvements in their health, those should be a priority for reimbursement, whereas other ones can wait or should be deprioritized. I think that would be a good way.
Okay, and what good practices from other countries could be considered for implementation in Poland?
Yeah, so what we have seen when we made these country comparisons, especially with the Visegrad countries, is the HPV vaccination, to take this example again. Hungary, how do they achieve an 80% vaccination rate, in Poland only 17%?
Fantastic.
How? So the reason is that the way you deliver the vaccine or the setting is different. In Poland, you have to take your child, your daughter or your son, to a healthcare center to get vaccinated. In Hungary, the vaccination is done at the schools. So the physicians, the nurses come to the schools and there they make the vaccination. And also, you know, from other countries around the world, we know that school-based systems are much more successful to achieve a high vaccination rate than when the parent has to make all the effort to schedule an appointment, take the child to to the healthcare center. So this would be one easy change to achieve good improvements.
It's a fantastic idea, and because of the children, will treat the vaccination like something completely normal.
Yeah, and especially if you explain it to them, the benefits. I mean, as a girl, you no longer have to be afraid to get cervical cancer, and there are also some head and neck cancers is prevented, and other cancer types also for boys. So it's a great way, I think, if you explain it even to young persons. I mean, it's 12 to 13 years old in Poland. The girls and boys that should get vaccinated, they are able to understand this, and I think most will realize that this is a very wise decision to make.
So prevention and education.
Definitely, yes.
Okay, thank you very much for this interview.
Thank you so much.
Thank you.